Traumatic brain injuries. If you or a loved one has suffered one of these, you know how life-altering it can be. And there's really 3 phases of a brain injury. So number 1, you have what's called the acute phase. Say you were in a car accident, you suffered a massive brain hemorrhage, or you were a victim of medical malpractice, didn't have the proper fall precautions in a hospital in place, fall and hit your head. Now you have a massive brain hemorrhage. The acute, you initially have what's called the acute phase. So that's the initial hospital treatment that you receive as a result of your brain injury. So it can range anywhere from brain surgery, where they try to evacuate, get rid of the blood on your brain and give your brain some room to swell, to just hospitalization, where they watch you and make sure that they don't have to do any surgical procedures. So that's the acute phase of a traumatic brain injury. After the acute phase of a traumatic brain injury, you have what's called a sub-acute phase of treatment for a traumatic brain injury. Now, subacute phase, think therapy. So you could have physical, occupational, and cognitive therapy. There's special therapy relating to your eyes if you're dizzy. It just depends how severe your brain injury is. So during the subacute phase, if you had a severe brain hemorrhage, you could even be learning how to rewalk, talk, eat. All these things are on the table during what we call the subacute phase of a brain injury. Once that initial therapy is over, then there's something called the chronic phase. So if you have a permanent brain injury, it's not going away. Now you have to learn to deal with it chronically. So you're at home now, and you're trying to relearn how to live with this brain injury. That's the chronic phase. And so what's tough about this is there's very few resources available out there to help. There are a couple out there, though. Something called Hansen House, which is a traumatic brain injury clubhouse that can help through group sessions, help you relearn how to live with the brain injury. Additionally, there's a lot of mental health therapists, professionals that can assist with that. But also during this chronic phase, what I like to think of as the forgotten victim is the caregivers. The caregivers' lives have also drastically changed as a result of the traumatic brain injury. These caregivers need to also remember to take care of themselves, either through support groups, individual therapy sessions, and so on. If you have any questions about these 3 phases of a traumatic brain injury and the treatment, give us a call. 216-222-2222.